Today I'm going to answer the most asked questions about keratosis pilaris, aka chicken skin. Question 1. What is the main cause of keratosis pilaris? You know how we get goosebumps when it's cold or you get scared, right? Well, is there anyone out there who has these goosebumps all the time? These actually aren't goosebumps, but something called keratosis pilaris. When your pores are filled and clogged with dead skin cells, bumps appear on the skin like goosebumps. Keratosis pilaris occurs when old dead skin cells are not removed. Our skin sheds old dead skin cells every 28 days and produces new dead skin cells, and this is called a turnover. If there's a problem with the turnover cycle, the old dead skin cells do not shed. The dead skin cells pile up around the pores, clogging them as a result. Also, excess keratin, which forms dead skin cells, increases the amount of dead skin cells and can clog the pores as well. The causes for excessive keratin production includes dry skin, external stimulation, inflammation, and genetic factors. Question 2. How do I get rid of keratosis pilaris? The key to getting rid of keratosis pilaris is to regulate the skin turnover cycle in order to shut off old dead skin cells. To regulate the skin turnover cycle, you need to exfoliate and moisturize. So now I'll tell you the ingredients that are effective for exfoliating as well as how to exfoliate. AHA is a water-soluble exfoliant. While AHA exfoliates dead skin cells, the water-soluble components draw in moisture to keep your skin feeling moisturized. BHA is an oil-soluble exfoliant. BHA not only exfoliates dead skin cells, but it also removes impurities deep inside the pores. Plus, it's gentle on the skin that's prone to redness or sensitivity. Try applying a product that contains vitamin A on the areas you have keratosis pilaris. Vitamin A is an ingredient that accelerates the turnover cycle, so it helps remove the old dead skin cells that haven't been able to shut off and restores the turnover cycle back to normal. You can use a gentle scrub to remove the dead skin cells as well. However, if you use physical scrubs too often, it can be irritating to your skin. If you have dry skin like me, use scrubs to up to 1 time a week, and if you have oily skin, then use them 1 or 2 times. After using a scrub, make sure you moisturize. This is super important. Moisturize. Now, what does moisturizing have to do with the turnover cycle? If you have dry skin, it makes it difficult for your skin cells to shed. So make sure you apply a moisturizer in order to regulate your turnover cycle. Jojoba oil is rich in fatty acids that are similar to our skin's composition, so it's effective for keeping our skin moisturized. Question 3. Do I have keratosis pilaris or acne? So keratosis pilaris and Milliseed acne, when you look at them side by side, they kind of look similar. But they are 2 completely different things. Acne is caused by the skin's inability to release sebum due to clogged pores, and when acne is extracted, sebum comes out. On the other hand, keratosis pilaris is when the pores are filled with dead skin cells, so sebum does not come out even if you try to extract it. That's why you need to be careful not to think that your keratosis pilaris is Milliseed acne and, try to extract them. That's really bad for your skin. If you try to extract or tear them roughly, the area can get infected with bacteria and it can cause pigmentation, so you need to be able to distinguish between the 2. If you're having a hard time telling them apart, you can always visit your doctor for assistance. Today I talked about the causes of keratosis pilaris, how to take care of them, and the difference between keratosis pilaris and acne. If you want to learn more, check out these videos on keratosis pilaris.